Good morning, good afternoon, good evening. Welcome to today's special joint seminar, the Schwartz-Reisman Institute for Technology and Society and the Joint Center for Bioethics at the University of Toronto. My name is Jennifer Gibson. I'm director of the Joint Center for Bioethics, and on behalf of my colleagues at the JCB and the Schwartz-Reisman Institute, thank you for joining us. Before we begin, we wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Today's special joint seminar represents a partnership between the JCB and the Schwartz-Reisman Institute. For the Schwartz-Reisman Institute, today's seminar is a continuation of its excellent weekly seminar series, which brings together the Schwartz-Reisman community and beyond for a robust exchange of ideas to advance scholarship at the intersection of technology and society. For the Joint Center for Bioethics, today's event is part of its weekly bioethics seminar series and is also the 5th annual JCB lecture on ethics and governance of AI for health. The annual lecture began in 2018 with a generous gift from AMS Healthcare and was co-hosted previously by Women's College Hospital's Institute for Health System Solutions and Virtual Care. The mission of the annual lecture is to provoke discussion and to foster interdisciplinary exchange on the ethical, social, and political issues associated with the development and use of AI and related technologies in health. It is in that spirit that the JCB and the Schwartz-Reisman Institute have brought our communities together around a shared interest in this topic. We are delighted that you have joined us today. A few logistics before I hand the proceedings over to today's moderator. Please note that today's seminar is being recorded and will be posted on the Joint Center for Bioethics website and YouTube channel and the Schwartz-Reisman Institute's YouTube page for future viewing and reviewing. If you would like to use live transcription, you can turn this on by clicking on the live transcript button at the bottom of your Zoom screen. The format of today's seminar is as follows. Our speaker will present for approximately 40 minutes in total. This will be followed by brief remarks from two discussants, which will open the Q&A portion of the seminar. During the Q&A portion, we encourage all participants to raise the hand function in the Zoom meeting controls to ask a question. Now, it is my pleasure to invite Professor Jay Shah, the JCB's Research Director of Artificial Intelligence, Ethics, and Health, to introduce our speaker and to moderate today's joint seminar. Thank you.
Thank you, Jennifer. Hello, everyone. And it's my absolute pleasure to introduce today's speaker, Katie Shilton. We've been working for quite a while to have Katie come in and give this talk, which has ended up being virtual, and certainly looking forward to it. So Katie is an associate professor in the College of Information Studies at the University of Maryland, College Park, and leads the Ethics and Values in Design Lab there. Katie's research explores ethics and policy for the design of information technologies, and her work has really been an inspiration to me and many others who I know of around the world. She has been at the leading edge of much work on ethics of digital and data-intensive technologies for years. So just a few remarks to put some of Katie's research into context. Katie's a principal investigator of the Pervasive project, a multi-campus collaboration focused on big data research ethics. Some of her other projects include work to improve online content moderation with human-in-the-loop machine learning techniques, analyzing values in audiology technologies and treatment models, and designing experiential data ethics education. So certainly some of the kind of most urgent and important topics in this domain in the present day. She's the founding co-director of the University of Maryland's undergraduate major in social data science. Her work has been supported by multiple awards from the U.S. National Science Foundation. Katie received a BA from Oberlin College and a Master of Library and Information Science from UCLA and a PhD in Information Studies from UCLA. So without further ado, please join me in welcoming Katie Shilton, and over to you, Katie.
Thank you. Let me share my screen. Okay, thank you so much, Jay and Jennifer, for that wonderful introduction. I'm really pleased to be here today. So today I'm going to be focusing on how health researchers might support increased public trust in research that relies on rich information that is generated about people through digital devices and digital interactions. And I want to start with an acknowledgement about the team that's behind this research. This work really is a team effort, and I'll talk more about the Pervade team that's been working together on this in a few minutes. But I wanted to particularly acknowledge my collaborator, Emmanuel Moss. He's an anthropologist who you will see was critical to shaping this talk and the paper that it's based on. We've given sort of a version of this talk together in the past. So some of the ideas in here are his as well. And I wanted to make sure you knew that. I have his contact information at the end of the talk as well. All right, so the plan here, all right, so I'm going to start today by talking about what I mean by digital health research and data science more broadly, and why I think there are trust problems in this area. Then I'll talk a little bit about why the existing infrastructure we've built for public trust in research ethics, the Belmont report and facilitation of that report in the US by IRBs and in Canada by REBs, currently creates a helpful but kind of orthogonal infrastructure for guiding research that relies on large collections of human digital data. And I'll talk about another discipline that has struggled with a mismatch with existing research ethics infrastructures, that of ethnography. I'm going to talk about some of the parallels between ethnography and digital data research, parallels that have a lot to do with that mismatch to our current research ethics governance infrastructure. And I'll talk about how I think those parallels can help us think through design interventions to support trustworthy data use based on excavating two things that are too frequently paved over in data science and in big data research: participant awareness of data use and reuse, and attention to power relationships in that research. All right, so we'll start here. Digital data has become a gold mine for research, using digital data to understand people and their health, as well as to train systems to make predictions or decisions for and about people. So that's the sort of AI piece of this, and data science and AI are very linked. But new data collection methods have also raised new questions about ethics and participation in this sort of research. You might remember, if you've been in this field a while, a furor that was a public furor that was set off by Facebook's 2014 emotional contagion study with Cornell University researchers. It was a partnership between the two institutions. And analysis by my colleague Casey Fiesler and co-authors of public reaction to that study used public comments on media articles to study the backlash, to try and figure out what it was that people were so angry about. And that analysis revealed fundamental disagreements about what Facebook is and what a user's relationship to it should be. And in particular, Facebook users objected to the feeling of living in a lab, of being observed for study while online. And this sort of mistrust of living in a lab while you're online goes broader than just Facebook, right? A survey of Twitter users done by Fiesler and Preferis found that a majority of users are surprised that tweets are used in research and feel informed consent should be necessary. If you're familiar with the world of digital data research, that may be a pretty surprising finding because tweets are used in research all the time. But Twitter users don't necessarily know that. And respondents in that study expressed willingness to participate in research, but it depended on the purpose of the research, the team in the institution, and the mechanics of how that research would be conducted, the kinds of things you might discuss in a consent process, in a traditional informed consent process. And we're even seeing a backlash to sort of pervasive forms of data collection in research that uses traditional informed consent mechanisms. For instance, a recent survey of habitual survey takers, people who regularly participate in surveys for research purposes, indicated that only 33% were willing to participate in cell phone-based data gathering, in addition to taking surveys. That study was conducted in Germany, so it may be a slightly more privacy-sensitive population. But I think it's still indicative because this was a group that regularly contributes to research. And finally, studies indicate that trust issues in digital data research may, with pretty good reason, be even larger in traditionally marginalized communities or historically marginalized communities. And importantly, this research backlash is occurring at the same time as a more general backlash against the platforms that create the data at the heart of much of data science. There are now regular headlines and podcast episodes and even a major motion picture or a Netflix documentary about what are increasingly viewed as the ethical failings of big tech. The tech industry broadly has struggled with whether and how to talk about its politics, its value, its social obligations, and its role in controlling increasingly pervasive data about all of us. So what should digital data researchers do in the face of this kind of mistrust and uncertainty? With colleagues, I've been part of the Pervade project, which is a 5-year grant-funded project from the U.S. National Science Foundation to study empirical questions in data ethics. And at the heart of our project has been a question of trust in digital data research. And what we saw when we started looking into ethics in data science and digital data research was that most of the solutions that were on the table, this was like 2016, always a long time ago, at that point, were reliant on approaches that had already been developed for doing research ethics, but weren't a perfect fit. They weren't really sufficient for the emerging paradigm of doing research with big digital data sets. So as part of the Pervade project, we've conducted surveys of, and I want to preface by saying these are American platform users. And one of the things we'd like to do is some comparative work in this space. But these studies were American platform users, partially because American platform use is very unregulated. For instance, in contrast to the EU. We only have data on Americans at the moment, and I realize that is a limitation. But we collected surveys of American digital platform users to try to understand the factors that matter to the acceptability of research uses of digital data. And with my colleagues Sarah Gilbert and Jessica Vitak, we used factorial vignette surveys, which are a kind of survey where you give people little stories, very short stories, 3 sentences, and you systematically change the factors in those stories to assess acceptability of research uses of data on contrasting platforms. So we studied dating apps, Instagram, Reddit, and Facebook. And what we found was that there are different expectations between platforms depending on the research domain, the purpose of research, and the data being collected. And the acceptability of digital data research depends on the context in which it takes place, both the type of information and the platform it's collected from, and also who is asking and why. This was not a surprise for us. This matches both common sense and what is predicted by privacy theorists. But interesting, I think, for this audience, health research is a context which generally increase the perceived acceptability of data uses when compared to other forms of research. So people have sort of a feeling of trust in health research. This also took place during the COVID pandemic, which I think may have influenced this finding. But the broader finding of sort of it depends on the context, matters because it places the onus for determining appropriate collection and use of data on researchers. But one clue that we found across our surveys that I think can help researchers is the factor with the greatest impact across all platforms was consent and awareness of data collection and use. So American and Canadian research ethics, since the time of the Belmont Report, have been dominated by procedures that rely on in-person research contexts. The research communication relationship that assumes a one-on-one ability to get consent from participants and then debrief them afterwards if necessary. And we also have long assumed the assumption that researchers can predict the risks and appropriately balance them with benefits in their research context. And we've made an assumption that vulnerable populations are limited to sort of distinct nameable groups, generally in the research ethics context with lessened autonomy, so children, prisoners. And so it makes sense that when you ask American platform users, when they're asked about research uses of online data, that those users rely on assumptions of protections that US users have grown used to over the last 50 years, Yes. And the problem is much digital data research can break these assumptions. So, as some of you may have experienced, some health research projects, for instance, use existing data sets, existing digital data sets, those collected by platforms, those collected by other researchers using cell phone-based technologies, things like that. And those projects may be exempt from REB or IRB review and the protections that would come along with such review. And further complicating this is that the risks and harms of data research projects can be quite different. For data research projects, some benefits may accrue directly to the individual. They might get to use a digital platform that's being used to collect pervasive data, like a step counter, or they might get individualized health advice or feedback as being part of a study. So there may be individual benefits. Meanwhile, some of the risks may be societal rather than individual and can be quite difficult to predict. So if data research projects learn something about a category of people from a small study, maybe a stigmatized diagnosis, it can extrapolate out and make decisions about all members of that category. The harms might be pervasive, they might involve people outside of the scope of the experiment, and they might be persistent. So the standard toolkit for making decisions about traditional experimental research, informed consent forms, data de-identification, consideration of narrowly scoped vulnerable populations, aren't completely protective for data research. Some kind of new toolkit is needed. And when the Pervade team started thinking together as a team about the uneasy fit between digital data research and common rule protections in the US and similar protections internationally, it reminded us of another field that has grappled with an uneasy fit with the assumptions behind the Belmont and IRB infrastructures, and that of ethnography. And digital data research has more in common with ethnography, I'm going to argue, than is immediately obvious. The instruments are different: human senses instead of digital sensors, individual sense making instead of algorithmic pattern matching. But both forms of research rely on integration and interpretation of multiple data streams, and both require judgment about what features of a context are relevant for meaning making. The ethical challenges resonate between the two methods as well. In a classic ethnographic methods textbook, Spradley writes, "No matter how unobtrusive, ethnographic research always pries into the lives of informants. Participant observation represents a powerful tool for invading other people's way of life. It reveals information that can be used to affirm their rights, interests, and sensitivities, or to violate them." Substitute the words digital data research, and the concern is the same. Reflecting first and foremost on whether data will affirm the rights, interests, and sensitivities of the people it documents, or alternatively violate those interests, should be a first order concern for trustworthy digital data research. Ethnographers' dedication to the rights and interests of subjects of participant observation comes from a long and painful history of the use of ethnographic methods. The history of ethnographic research is also one of colonialism. The earliest ethnographies were conducted by American and European academics through fieldwork among indigenous peoples, and this practice continued well into the 1980s. As post-colonial movements took hold in academia, and particularly within anthropology, scholars began to grapple with the ethics of their work, and a recentering of the rights of and obligations to research subjects was a result of a field-wide reckoning. Today, ethnographers are expected to reflect on their power as researchers, as well as on what they are taking from the communities that they study. And ethical concerns about early ethnographies were not limited to colonialism, but also extended to other historically disenfranchised groups. One of the most famous examples of controversy over ethical issues in ethnography surrounded Loud Humphrey's 1968 dissertation and his later book titled Tea Room Trade: Impersonal Sex in Public Places. In the study, Humphreys conducted observations of male-male sexual encounters in public restrooms, known as tea rooms. He disguised his identity and his purpose as a researcher. He did not obtain consent from his participants, and he used license plate numbers, sort of early big data, to discover the identities of otherwise anonymous men from the restrooms. The ethics of the tea room trade caused an uproar at the time and are still debated within sociology. So data science and digital data research may not be as obviously entangled with colonialism as anthropology, although there are questions here as well, especially about data use from international contexts. But we do use tools and methods entangled with other problematic practices. We use data biased by historical injustices and data collected frequently without participant awareness in the name of surveillance and commercial interests rather than direct interests of data subjects. And then that data can be repurposed for reasons beyond what participants may have consented to, if they did consent at all. If digital data research is to be trustworthy, we need to explicitly grapple with the fact that our data and our methods are also used for surveillance and control. So ethnographers' reflections on awareness of their data subjects and their power relationships with research sites are inspiring. Along with the Pervade research team, I've been arguing that researchers using pervasive data should probe appropriateness and complex potential harms of their research using two lenses that are directly inspired by ethnography. First, data scientists can learn from ethnographers' contextual sensitivity and experience helping research subjects interpret research participation by reflecting on awareness. Ethnographers have developed a suite of techniques in their practice to gain the trust of participants. First, ethnographers must gain what's called entree, which is the permission of participants to be in their space and lives. Ethnographers frequently encourage research participants to read parts or all of their analysis, using techniques like participant checking to check the validity of their observations and findings. Some ethnographic traditions move beyond entree and participant checking to collaborative ethnography, which involves people in the creation of research goals, data collection, analysis, authorship, and dissemination. Data scientists, I think, can really learn from ethnographers' reflections on power as well. Ethnographers were dealing with a legacy of distrust due to their use of the tools of colonialism. Data scientists are dealing with a legacy of distrust due to their use of the tools of pervasive surveillance. We are bound up in the techlash too. So over time, ethnographers made efforts to diversify their discipline and shifted topics of study by including studying up, which is performing ethnographic research on groups more, or at least equally, rather than less socially powerful than the researcher themselves. So what might analogous reflections on awareness and power look like in research that uses digital data about people? To think about what awareness and power look like in data science and digital health research, we found it helpful to start from the data itself by mapping data collected from digital devices and interactions on two spectra that I've illustrated here. This is a heuristic for thinking about where data come from that can help reason about what people's expectations are about what might be done with that data. First, people's data gets collected somewhere along the continuum of private to public. And so private data might get collected with an explicit or implicit expectation of privacy, especially for things like medical records or financial documents. And yet, this private information might wind up in data sets used for one research purpose for another, in a hospital system, something like that. Public information gets collected for research too. Twitter feeds, census data, likes on a YouTube video, those are all data that's available in public. Second, the second axis here is that data can be more or less intentionally created. So when I press send on a tweet, I know that I'm intending to put something out there into the world, just like I know that I'm liking a video or filling out a census form. But of course, I'm also contributing to data sets unintentionally all the time. I don't intend to create a log of location every time I open a Google product on my phone, but I do. I don't know when my keystrokes are automatically logged on a web form or if my IP address is being logged when I watch Netflix, but these data are nevertheless being automatically created about me. So most data fall somewhere on this chart that I'm showing. Broadcasts are what we call public data that were intended to be so by the person they pertain to. So I know when I'm tweeting and I want it to be public to other people, I have to start taking tweeting out of my examples. So I know when I'm posting on Mastodon and I have some idea of what who might see that, right? But there are a lot of shades of gray here. So I might post something to a Reddit health forum and assume that it will stay within that disclosure context, not appear in a high profile paper in Nature, for instance, although it very well might, right? Secrets are private, but I know when I'm sharing them. I usually have a pretty firm set of expectations about the circumstances under which they'll be kept secret. When I tell my doctor something, they may enter it into a health record, and I know that record is supposed to be kept confidential within the medical system and wherever those porous boundaries might be. Similarly, if I participate in a health research app that sends me ecological momentary assessments, I both understand I'm creating the data and presume it will be kept confidential among study researchers. Exhaust data is available and it's created in public, not in my home or in a very private space, but it's generated without me necessarily taking an action. So traffic data that includes a count of my car, CCTV camera footage, a satellite photo of my house, those are all exhaust data. In the health research space, we might think about social contact traces provided by cell phone networks, for example, for contact tracing as exhaust data. Espionage data is also created without an action or intention, but it's created in more private settings and is frequently without my knowledge. This would include telemetry data or other sensor data from a phone, or a piece of malware that's collecting keystroke data from private messages. And there are shades of gray for all of these categories, but thinking about where data come from serve as a starting point for thinking about the ethical implications of data research. And just because data comes from one box doesn't make it completely ethical to use or completely unethical to use if it comes from another box. Each box has its own set of questions researchers need to ask themselves and its own ethical applications. So the first of these have to do with informed consent. Just because someone posted something intentionally doesn't mean they consented for it to be used in a research project. So we might ask, how do the terms of service or other agreements users may have made impact whether it's permissible to use that data in a research project? Are there norms on the site that we're collecting from, or even the subsite, if it's a community on Reddit, for instance, or even for sharing or reusing that data? And we can ask what objections people might have for their data being used in a project and whether or not it's feasible to obtain their consent as part of a research project. Because as we know, public data can have implications for privacy. When someone has shared their mental health status on a public broadcast forum where they're part of a community of people who follow each other, having their mental health status shared in a research paper might be a totally different matter for their privacy. And even if data is delinked from a personal identity, it can be used to re-identify people and reveal things about them that they might not want shared. Geolocation data, for example, can be used to follow someone home from a public event, a protest, to their house. And data that has been purposefully anonymized to hide who it's connected to can be de-anonymized, as numerous studies have shown. And this continues to be just a very challenging problem for data sharing. Okay, next, the second principle inspired by ethnography is reflecting on power. Thinking about data sources, so like we were doing before, can also help us think about a principle of justice. Does data come from a particularly vulnerable population? Is it more likely to produce errors when it's applied to a population that has historically been harmed by such errors? Does it help a less vulnerable population at the expense of a more vulnerable population? And does the research design include members of the population group it is targeted at helping? Particularly in the US, but also in non-US contexts, data-driven technical developments have been designed for the targeted oppression of minorities and have failed to live up to liberatory promises. Researchers need to consider this history and these power relations. Consider whether it's appropriate to make a given community or population more vulnerable by collecting new forms of data or through secondary uses of that data. So this consideration, how to do this, right? This might involve spending time physically or virtually in a community to understand their norms, much like an ethnographer might, collaborating with a community to serve their needs, or speaking to the gatekeepers to understand specific harms. For example, particular harms around amplifying content beyond its intended audience. And pervasive data research should really try to emphasize the standard drawn from political representation movements and disability activism. Nothing about us without us. Using pervasive data to study populations without significant representation from those groups risks erasing the standpoints and lived experiences of the people behind that data. And just as in ethnography, there's an argument here for studying up. Studying people with significant social or political power, studying health systems, insurance companies, for whom public accountability is important. Of course, determining your own power relative to research subjects is a complex process, and we realize that it is a big ask for researchers, as well as for the people who might be in positions to advise researchers, for instance, REBs. And advisors and things like that in academic networks. But there are already numerous helpful frameworks for thinking through issues of power that have been adapted specifically for diverse and varied forms of digital data research, including feminism, anti-racism, anti-colonialism, and queer theory. For example, the excellent recent book, Data Feminism, explains principles for approaching data science from a feminist lens. And attention to power, and as well, attention to power in situated forms of data science continues to grow. For example, this recent paper by Penstead et al. From Treatment to Healing, Envisioning a Decolonial Digital Mental Health outlines approaches for addressing power in digital mental health contexts. So frameworks like these can provide concrete guidance to researchers considering how their protocols might unevenly subject participants to increased vulnerability. So if the answer to is a researcher's data collection or use ethical is always, it depends, how can we help data scientists and health data researchers walk through variables that matter, how variables might matter, like awareness and power, and how those things might impact their individual projects? To meet this challenge and to hopefully be helpful to diverse research communities, we are designing and testing the Pervasive Decision Support Tool, which is not a very catchy name. If you have ideas for names for us, we would love to hear them. The vision of this tool is as a resource. This is not a governance tool. This is a tool that recommends actions and videos and readings and background material to researchers for their targeted cases. We see it as a supplement to other research ethics education efforts, existing courses, online trainings, things like that. And at the moment, this is a prototype. It's not yet available, although we should have a prototype up on the Pervade site soon. But I'm going to tell you a little bit about how we've envisioned its use and features, and we would love to get feedback about if a tool like this might be useful to you, and specifically what we might do to tailor it or make it more useful for those of you doing digital health research. So the way we've mapped this tool, it's essentially, it's an online, you can see a little bit of it here. It's like the BuzzFeed quiz for data ethics is what we're telling it. It guides you through a series of questions about your data preparation, your data collection, analysis, storage, and processing, and gives you bits of feedback along the way. I'm going to click into it and just see if I can show you. Are you able to see that in the screen share? Did that work? So it gives you questions here, and as you answer these questions, it gives you pieces of feedback along the way. And then at the end, you will receive an email profile that sums up essentially how much work you have left to do before you can begin your project. So what we do is we give you an analysis of you're sort of on easy mode, you're on intermediate mode, or you're on hard mode. So we don't say don't do this project. We just say, okay, you know, like if you're using hacked data and you haven't gotten consent and you're studying stigmatized diagnoses, like you have a lot of work to do here, right? As opposed to people who are maybe doing something where they're studying up using public-facing data. So it's a series of resources and guidelines. And what the tool is meant to do is encourage research design for trust. It walks researchers through reflexivity about every part of their research design, prompting places where researchers might increase their engagement with participant awareness and power. For example, in its opening section on research goals, the tool uses quiz questions to ask researchers to consider whose interests are represented in their research and whether there are existing disciplinary or codified frameworks that they might draw from for attention to research ethics. We ask questions about power and representation, prompting researchers to consider whether they're studying up or down or neither, and how they might increase representation on their own research teams. We delve into contextual expectations that are embedded in data sources using the the quadrants concept that I illustrated earlier, as well as discussions about how data was acquired and the norms of the collection context. We discuss security and retention best practices, challenges of analysis, including specifically the challenges of constructing meaningful binaries and categories, linking data sets, and potentially distressing or harmful inferences about data subjects, or even populations beyond the data subjects themselves. And finally, we close with questions on resources about data sharing, including pointing out challenges around de-identification and balancing open science principles with participant protection. So our tool is designed for researchers, and we hope it will support them not only in their own research, but provide experience to lead reflection on awareness and power with their students and collaborators. And the Pervade team has been conducting interviews with working data scientists focused on how they actually are navigating these issues now. And while these are still in analysis, we're still working on the paper. But a spoiler alert for an emerging finding is that data scientists are already successfully grappling with these issues, and in many cases, their practices for navigating them tend to look like those of qualitative researchers. We've heard numerous stories about researchers spending time in the communities that they're studying to learn the nuances of how data is shared and the expectations of participants in those spaces. For example, we've heard stories about a PI telling students that they're not to harvest data from a video game until they've completed 100 hours of gameplay themselves. We've heard about researchers thinking critically about whether and how they should perform research on vulnerable populations and striving towards more participatory forms of big data research. We've heard about writing positionality statements, which is really common in qualitative work in their publications, and of turning the substantial tools of data science onto structures of power rather than onto individual people. So using pervasive data to study political campaigns and advertisers or the platforms themselves. Researchers aren't the only ones who can and should grapple with awareness and power in data-driven research. Some of what we are discussing needs better technical tools and better design technical tools to help us do ethical data research. For technologists, for the people developing the systems that so much digital data relies upon or helping us access those systems, supporting data researcher and data subjects' awareness of digital data research is paramount. Can we create systems that would help people understand their data doubles, the broadcast, the secrets, the exhaust, and the espionage data that a project requires of them? Another hugely important area of technical research is in the transparency and explainability of algorithms that use data to make health decisions for and about people. Right? A huge piece of awareness is helping people understand what decisions are being made about them, and that is a socio-technical problem with a significant design element. Technologists are also working on innovations in things like federated learning that enable research with multiple data sets while minimizing new data collection and helping guard against re-identification risks of using multiple data sets. We also hope that professional organizations can be part of encouraging new research norms in health and digital health and digital data science. We hope professional organizations will establish professional norms and codes for trustworthy data science, as anthropologists and sociologists have done. This might consist of setting up clear guidelines or procedures to follow, but it could also consist of peers modeling for each other what trustworthy practices are, peer checking of research methodologies in the research design phase, which is kind of what we hope to do with the tool, and publishing methodological reflections on trustworthy research practices in professional trade journals. If you are innovating new consent procedures or you are doing cool things around, reporting on people's data doubles, like please share it out, right, in trade journals so that the rest of us can see what you're doing. Paper reviews, frequently run by professional organizations, are another area where we can build mechanisms for data science ethics into the structures we already have to rely upon for trust in research more generally. Reviewers can expect and prompt authors for reflections on the whys and hows of awareness and power. And this is already happening formally and informally in places like ACN SIG-Chi, which is the primary human-computer interaction community, which has a research ethics committee that helps advise reviewers when they encounter ethical issues in research papers. And in NeurIPS, which is a machine learning conference, which requires, quote, authors to put their work in context and reference the potential harms, reflect on potential harms, as well as appropriate uses of human data sets. Of course, it's not a good idea to put all of the onus for data science research ethics on individual researcher self-governance. We need to think about how existing trust infrastructures like IRBs and REBs can support researchers doing this work. I want to return to the working analogy with ethnographic research. Ethnographic research norms were not always a fit with IRB expectations and REB expectations on campuses. It took collaborations between ethnographers and campus oversight bodies to figure out how to best understand things like informed consent in ethnographic settings. And I think we can have a similar hope for digital data research. IRBs and REBs are already centers of research ethics expertise on campuses. And they're already consulted on, for instance, things like blurry lines around using student data in research. So could researchers tap into this network, even if we're not required to by legislation? Their developed expertise around forms of awareness that aren't formal consent, or their knowledge of power relationships between researchers and research subjects. I think thinking through what a systematic education effort around data science would look like in partnership with REBs is worth doing. So we hope that researchers will embrace reflections on how to decrease participant vulnerability, and that will hold each other to higher ethical standards, particularly with respect to openness with data subjects and reflexivity on power and impact. For many of us across disciplines, reflection on awareness and power are not necessarily required by our current professional practices or REB processes, but within other traditions, like ethnographic research, such reflections have become bound up with definitions of and norms for ethical research, good methods, and good practice. So through design for such reflections, technologists, individual researchers, and the organizations that support pervasive data research can all contribute to a more trustworthy research community. So I'm going to end here with a link to my project websites and my email address, as well as Manny's, and love to hear from the respondents and take questions.
Well, if I may jump in, Katie, thank you so much. Just like what a remarkable accomplishment of interdisciplinary perspectives on this topic. And I mean, it's a sort of a trope now to identify the importance of interdisciplinary work at the intersection of data science, research ethics, ethics education. But what you've done here with your colleagues on the Pervade project is just something that's both theoretically sound, historically informed, and imminently practical. So I think I'm really eager to hear about the interest and the response you've had from this work, and we'll get to some of that in a moment. Just a quick note to say we couldn't see the screen share.
Oh no, I'm so sorry. It's not that beautiful.
Well, and as you talked, you narrated everything that you were seeing, and I think I could follow seamlessly. So just for that extra bit of context there. Now we do have a couple of members of the JCB and SRI community who have prepared some thoughts in advance, and we'll have an opportunity to provide a response to your talk, Katie, and then to pose a question or two as well. So I'll introduce both of these respondents now, and then we'll go to each of them in turn. So first we have David Lee. David Lee is a professor in the Department of Electrical and Computer Engineering at the University of Toronto. His research interests are focused on securing mobile platforms, cloud computing security, and bridging the divide between technology and policy. And I'll introduce our second respondent as well, Meena Andiapan. Meena is an assistant professor at the Institute of Health Policy, Management and Evaluation at the University of Toronto. Her research focuses on individual level and organizational level responses to wrongdoing and the role of emotion in workplace relationships. So I think we'll have two unique and different perspectives in response to your talk, Katie, and I'm looking forward to hearing from both David and Meena. So David, we'll go to you first. Please go ahead and share a response and pose a question.
Thank you. Yes, this is a fascinating talk. I really enjoyed it. And I have a ton of questions I want to ask, but they said only one. So I'm going to be selfish and ask the one that is going to help myself and my community the most, which is, so I work in the computer security community, and increasingly, even historically, we've been worried about both what we call black hat and white hat. So black hat are like the bad guys, the attackers. And sometimes it's well acknowledged that to understand how to best defend or protect systems, we have to think like the bad guys. And so there are researchers within my community, a good number of them, that actually perform attacks, see what's possible, and then document them and publish those results. This is a well accepted like mode of research. But increasingly, as things are more connected, it's hard to do or test some of those. It used to be you could just test on your own computer system. Now there are live systems out there with people involved. And so there were a couple incidents that really kind of got criticism from outside our community. And so we've started to establish similarly these research kind of committees that help advise people. But it's been tough, and we've acknowledged that the REBs and IRBs don't have kind of the domain knowledge to do this. So my question is, what generally advice do you have, like when you're actually, want to do harm, but or to see if harm is possible, and you're trying to check, where is that line where you can scientifically prove that it is possible, but not actually cause any harm, and then even harm is like a scale, right?
This is such a great question. And the parallel efforts right now in computer security are really interesting to me. In fact, when we started this project, I have a project with another collaborator, Megan Finn at the University of Washington, where we were really inspired by computer security ethics researchers, because this has actually been a discussion for longer in that space, right? Like, so there was the Menlo report in like 2012, which was before many people were paying attention to this, where the computer security and network measurement researchers got together and said, look, we're, right, exactly as you described, we are doing these tests on live systems. We need to do that. It used to be that network data was just in our lab, but now it's, it's our entire university, and, there are people here. What do we do? And Menlo kind of, they made a hard move, which is they basically adapted Belmont for computer security data, but as pervasive data researchers are finding, it's an uncomfortable fit, right? It doesn't, harms again, right? Harms may be pervasive, but they may not happen at all. And so I think, computer security is struggling in much the same way, although the issues are slightly different than in pervasive data research. In pervasive data research, it really is human subjects research, right? Like there are people whose data you are analyzing. Computer security research is a weird border case of not quite, there are people, but you might be studying the network, not the people, right?
Right.
So then, but you might harm the people in the process of studying the network. And, we don't have really good ways of disentangling those things. I think we actually need like deep philosophical work that I think that, Menlo wasn't set up to do. That would maybe be the next step there of like, what does it, how do we, when is harm acceptable, and how do we weigh risks in this really specific case of like harming people but not studying the people? It's one of the the places I know where you're not studying the people, but you could be harming the people. And I think about things like the Encore project, which got a lot of public criticism, or the Minnesota commits thing that
That's the one I was referring to.
Yeah, where it was there were potential harms to people, but the people weren't the research subjects. The people were the people who check in commits and things, right? So so that it's just an exceedingly hard space. So hard that I have I dipped my toe in and got right back out. As I was like, I'm not the person to, but I think, really deep, sustained philosophical thinking about what risk is okay in that space, and working, together sort of with disciplinary experts like yourself. And ethicists would be really, and social scientists, honestly, would be really productive in terms of figuring out.
Yeah, I was on the technical program committee for the Minnesota incident, so I kind of watched. I had front row seats to watch the whole thing like blow up. It was not fun.
I mean, right, it's a fascinating case study, but right, it's not fun for the people in the middle of the case study. No.
Thank you.
Yeah, I wish I had an answer. I don't.
Yeah. Okay. Thanks, David. Mina, would you like to go ahead?
Sure. Thanks so much. So Katie, this was a really, I echo David's comments. It was a fascinating presentation. I do a lot of qualitative work. So I found the parallels you made between ethnographic work and digital data research were really fascinating. So As a social scientist, I do organizational behavior. So we study people in organizations, right? Employees most of the time. So I guess something that, and I used to work in Europe where there is, in a lot of countries there is no IRB ethics anything, right? So it's very North American. And so now coming back to North America, I find, you're going through all these ethics, et cetera. And so I think it's wonderful that we're thinking about this. But when you go into a lot of companies and you're collecting data there, there's these companies are collecting whatever data they want, to be quite honest, right? And a lot of them don't think about the ethical implications of like doing internal surveys, questionnaires, doing work with their employees, ask them all sorts of things. Some are more cognizant than others. Like I've worked with the Army where they'll say, oh, we don't want you to record anything when you're interviewing, right? So like some are very strict about kind of ethical codes and data collection, and then others couldn't care less, to be quite honest, right? So I guess my question to you is really, what are your thoughts on like putting these kind of procedures and great practices in place, trying to create these norms for researchers, but how do we get sort of buy-in from organizations and from for-profit companies around this?
Yeah, this is such a good question. I've encountered similar questions working with platforms on researcher data access, to, for instance, Meta is interested in having people study elections processes on the platform because it's of international importance and interest to understand misinformation in elections on the platform. But do they give people access to user data, right? Like, and so they've set up a and I mean, because Meta has been the focus of such intense public criticism and had some research disasters in the past, they have come to care, at least about their public image around, releasing data to researchers, and have set up a very careful set of processes. So careful that it's actually very hard for the academics to get data involved, right? But to sort of try to protect users on their platforms, which is different from their employees, who I don't think they let anybody study, as far as I know, right? So this is such an interesting and hard question when you're interested in accessing data in a organizational context because you're interested in studying employees, which affirms the employee's interests, like I would say, right, in terms of like critical reflection about power in that relationship. That seems like a very just thing to do, right, to like and make sure that you like to study the employees, but companies may or may not want you to do it, and employees may or may not know about their digital data doubles at work and who has access to that data, and who doesn't. So I guess the first question I would sort of want to chat with you about is like, are there ways of doing that where you can also help workers see all of this data that exists about them that their companies have, right? Like, are there ways to sort of, because that would be, to me, one of the benefits of an arrangement where you were working with a company to study its workers would be to help workers understand, like, this is what they have about you. Like this is like all of the stuff that they, that digital double piece, right? Because I think employees frequently, like, we kind of know what our universities have about us, but we maybe don't think about it as much as we should, right? And it would be very helpful, I think, for a researcher to sort of create that data double, or to say, like, here's what's available, and help to navigate some of those lines around employees being okay with the research taking place, as well as the employer hopefully cooperating.
Well, I think that's where all of these kind of questions of power for me come in, right? Because there you have these huge differences in power, and then also when you're looking at like health research, for example, there are huge differences in power between the patient and the practitioner as well. So I think those questions come, even if they're not the same context, they come into play. So, right, they're so significant in across contexts, essentially, right? So who has power over the data, and how is it being used, essentially, and what is the kind of information of that, how is it being shared with the people that's affected by it?
Yeah. Yes, I think that that's so important, is like, not only are we coming into these questions, about with our own power as researchers, and that, but we need to consider power relations in the context as they already are before we get there, right? In terms of who has the data and who doesn't, and who has, who's able to process it and who doesn't. And so like, there's a state, right, that we're entering, where power, and like, can we change the power relationship there, and should we, right? Like, is it, and then making some calls about that. But I think just being really explicit about that, and you're a qualitative researcher, so like, right? Like it's about reflecting on the paper and like how you made the choice, and it was a hard choice, but here are the best, this was the best I could do, and here's why. It's like sort of all we're asking of data researchers.
Is that Mina? Did you want to follow up with anything else?
No, that's great. Thank you so much. And I see that there are plenty of questions in the chat. So I
Yeah,
see
thank you. Okay, so thank you so much to both of our respondents, and we'll open up. You can see we have quite a bit of time for some sort of open general discussion, and I'm sure we already have a couple of questions coming into the chat. So we'll just ask that participants use the raise hand function on Zoom if you'd like to ask a question. There's been some discussion already in the chat. That's totally fine. If you do raise your hand and you'd like to ask a question, we'll just ask you to introduce yourself before you make your statement or pose your question. And Tim, thank you. You've already shared some information in the chat. I see your hand raised, and we'll come to you next. So Tim, over to you.
Hi, so I'm Tim Mount Pleasant. I am a master's student at McGill in philosophy, focusing on bioethics. I have sat on the research ethics board at Ryerson University for 3 years. I currently sit on the REB at McGill. And the topic of science and research is a hot topic in Canada, with the panel on science and research having issued its recommendations in June, with the government of Canada issuing a response in October, with ongoing work in French language and that sort of thing in Canada. I guess the question that I'd like to raise, or the point that I'd like to raise first and then a question, is that in Canada, there is no legislation that guides research. That all legislation or all rules and regulations that are tied to research are tied to a funding agreement with the Tri-Council, and rules that only apply to agreement holders or work that's done under the auspices of those institutions. And therefore, research conducted by the federal government itself, for instance, isn't subject to research ethics, unless such as the public health part has opted to follow research ethics, the Tri-Council policy statement. So given that, there's another question in the chat around data that's used that emerges. So if you know McCaskill's book, What We Owe the Future, and Toby Ord's book, The Precipice, they analyze extinction level events and AI and the training data that machine learning process uses, and like what we train algorithms to do to make decisions for us, especially in relation to health data and bias, unintended bias. I guess the question, okay, so given that and the lack of legislation, I guess, that ties some of these decisions to what we ought to do as a nation, or as a more League of Nations type of situation, given that there's no legislation or rules that bind the decisions that we make in relation to the secondary use of data, for instance, like you mentioned, like there's research or work that's being done in relation to the data itself, not necessarily in relation to the people that the data pertains to. If you had to create legislation, if you were a legislator and you could legislate what rules ought to govern use of secondary data, or what decisions ought to be in the hands of machines and what ought not to be in the hands of machines, what would be, as you know, from like Star Trek The Next Generation and Data, or Astro Boy, or any of the 3 rules that guide iRobot, or anything like that, what would be the 3 rules that you would set for legislators and how they should
Yes.
make us as researchers or potential researchers restrict the way that we approach to machine learning and training data and all of these fascinating topics? Thank you.
So when we started the Pervade project in 2016, when we wrote the grant, our goal was to have a big convening at the end that was going to be a new Belmont for data, right? And that was where we started. And as we did the project, we kept coming up with these "it depends" conclusions, right? Like, well, if you're a researcher using data in this space with these people and like this, okay, but like, and people, and then if you're doing this and this and this with this combination of factors, no. And we're like, how do you do a Belmont? I mean, what are those? There are not those 3 rules, right? There's no clean, bright lines here. It's all very, very contextual. And so we said, what do we do? And that is when we started talking about ethnographic practice and the ways that ethnographic practice has changed over time. And we realize we don't need a Belmont. Like Belmont's not the answer. Cultural change in a discipline is the answer, because the cultural change has to be researcher reflexivity around the various factors that matter to ethical contexts. And so we sort of backed off from a legislative solution, a policy-based solution. Now, I will say, I often tell students that like, I work in the realm of ethics because it assumes good actors and that we have policy when we start assuming bad actors, right? And so obviously like their ethic doesn't solve everything, right? And like researcher reflexivity doesn't solve everything. But I think it can get us far, fairly far. I like to assume good actors. It's just, I'm much more comfortable. And so, but you're right that like, there may need to be bright line limitations on, you know, like, for instance, there are researchers now who say, and I have not decided if this is my stance yet, but who say, you know, facial recognition should not be done, research done, you know, like we should be done with that. That's it's never going to be used for enough good, and it will always be used by repressive regimes, right? And like we should stop learning how to do that. And you know, researchers who I really respect have taken that bright line. Legal scholars tend to be really good at these bright lines, right? And like I sort of operate adjacent to a lot of legal scholars, and they're good at saying those kinds of things. And I was like, well, it depends, the shades of gray. What if, you know? So you're not going to get bright lines out of me. But I do respect folks who are working on that space because I know how important it is to set some standards, right? And I do sort of lament that in the U.S. we did revise the Common Rule legislation, which is the legislation that sets what IRBs do and don't oversee, and that happened like right before the explosion of big data into the research scene. I mean, it was already happening, but it wasn't prevalent enough that it didn't get discussed in those meetings. And so like, I am a little sorry that like, that wasn't more a part of those discussions, and like, but nobody in the US is going to undertake that again anytime in the next 10 years. So like, we got what we got, and we, you know, and so we're switching to practice on my end. Like, we're going to try and advise all the researchers we can on practice. Does that help? I know I
Great.
weaseled out of it.
Yeah, great. Thank you. Well, because some of the challenge is like when you set the broad rules, like if you say humans must exist, like that's the guiding principle, we must exist. It doesn't eliminate the brain and the bat. We could still exist, but in that way, kind of thing, like the whole matrix issue. But
Yeah,
thank you so much.
It gets pretty tough.
Thank you.
Thanks,
Yeah,
Tim. Thank you. So I'll just call out people who have posted comments in the chat to see, you know, if you'd like to elaborate on your question, then we could have Katie provide a response. So Elisa, you've posted something in the chat. Would you like to come on to video or come off mute and share your comments? Thanks.
Yeah, totally. I thank you so much for this talk. I think this is super interesting. I'm really interested in research ethics. And my question was sort of addressed by Tim already, but it was sort of just on like, it seems like there are just like always going to be new uses for data, or things that, you know, even if you followed all the rules and did all of the correct things at the time it was collected, it could be used for like some new thing, some new project that we haven't even, you know, don't have the capacity to consider as a possibility yet. And like, how does that constant possibility of like unintended consequences, or just the constant possibility of like new uses of new kinds of research that we don't even know how to collect yet, fit into sort of like the current paradigm that you have?
Yeah. So within the paradigm that we have, we do not have a lot of work on unintended consequences. In fact, we don't have anything right now in the tool, which is now I'm thinking about, should we? That's actually a really good question about unintended consequences, right? Because, or in this sort of like future, like thinking about future uses of your data. I'm writing this down because that's a gap that we haven't addressed right now. I would say people on the Pervade team are quite interested in this question. Casey Fiesler has done a good amount of work along with some colleagues around mechanisms for helping people do the sort of design thinking based exercises for trying to do some futuring, right? To try to do unintended consequences. So she has an activity she calls Black Mirror writers room, where she like asked people to like write the Black Mirror story that would be provoked by their data, right, or by their application. And so that's like so there's a few other things. There's like sort of featuring with privacy workbooks in the CSCW literature, and there are a few other pieces that have attempted to start to build some practices around unintended consequences, because this is not something like humans in general know how to do very well, right? Like it's very, very hard. That's why they're called unanticipated consequences. That said, it maybe is something we could learn to do better, although it's very hard to evaluate these systems, right? It's fun to do Black Mirror writers room. Does it work? I don't know.
Yeah, like I would love that job though.
Yeah, wouldn't it be fun?
To be a Black Mirror writer.
So we could sort of build in, I think, some questions about, anticipating the unanticipated as part of our, and I mean, we probably should. It was very hard to know if you're telling people to do the right thing in terms of it. And this is again where I, tend to fall back on like reflexivity in publication as just a way of saying like, here's what we did think of and how we tried to avoid it. At some point we trust people to try and do the best that they can. And then, I think there's got to be, hopefully our future selves are willing to draw some bright lines and say, even though that data exists, it was collected for a really different purpose and we're not going to use it for this. We're going to try something else, right? And like, so there's some reliance on our future selves to also be good practitioners while we, try to be as reflexive as we can be.
Totally. Thank you so much.
Great question.
Thanks, Elisa. And it takes learning of epistemic humility to be able to just say, here's what we did.
Yeah.
Dawn, you've posted a question in the chat as well. Are you happy to come on and elaborate a bit?
Thanks, Jay. And Katie, thank you so much for our very engaging talk. I was particularly impressed with your decision support tool and that you're taking that approach to, rather than regulating, helping to educate and provide supports. That being said, I was a bit surprised when you said you saw much of this already being taken up in the research community, because it strikes me that data scientists use a different part of the brain than anthropologists do. And that I'm a bit surprised. Often when I've talked with students who don't come from social sciences backgrounds, this idea of reflexivity and whatnot, it stumps them a bit. They stumble over that. And I wonder, even if we're seeing this within the context of the academic community, the bulk of the research is probably going on in the private sector. And I wonder how we can get to them, or whether you see that happening, because when these students come out into the working world, they're going to be told by their mentors, we don't do that kind of stuff. We don't talk about that. Just get down to business. How can we address that?
This is so great. So this goes back to epistemic humility, right? The other piece of this that I think is so critical is for data scientists, is helping data scientists see that what they have is not truth. It is a construction, right? And like that data is faulty indicators and all kinds of things that social scientists know about, right? And try and adjust for and explain and and so one answer to this is easy for me to say because that's what we're doing at Maryland, but I do think it's really important, is starting to teach data science in the social sciences alongside, right? So we have this social data science program, which is shared between the iSchool, which is where I work and is more technical, although it's really socio-technical, and disciplines. So they choose a track within anthropology, sociology, psychology, economics, and they do social, like data science within those tracks. So they get theory and methods from the social sciences, as well as data ethics over from us in the iSchool. And with the idea being that if we're going to solve problems in context, we need people with skills from the disciplines in this class, as well as, R and Python and the ability to harvest huge data sets when appropriate. And so training students, I think, to think that way and to think about the problems of data, right? Like that data is not, there's no such thing as raw data, right? Like it's all an approximation of something. And what are you doing along the way? And so teaching data science to think that way. Now that works within universities, which is where much data science education happens, but not all, as you say, right? Like there's boot camps, there's all kinds of ways. And so it's going to be a slow adjustment. We got to start talking to employers, I think, about why do you want somebody trained in social data science? Well, I've got a pitch for you, right? I'm trying to get these folks into industry. I mean, we worry that the recent layoffs in the tech sector, that it would be the social scientists would go first. It doesn't look like it was entirely like it looks a little bit more distributed because lots of, for instance, big platform companies are hiring social scientists for these reasons because we understand indicators. So I think it's a generational shift. It's going to take a while, but I also think we can get there. I think we have to get there. It's not working with the kind of data science that just happens to be correlations is people are realizing that that's a big problem, and that there are better ways to think about data, more contextualized ways to think about data. So I think
that's great. I hope it doesn't take more than a whole generation to have that shift.
Me too.
Thank you.
Thanks, Don. A good opportunity also to hear about the joint program, which I think has sparked some interest as well. So I see, if there are additional questions, please use the raise hand feature. In the absence of that, I of course have a couple of questions that struck me as I was listening to talk, Katie. And one sort of summative type of question is around the response you've had. Are you far enough in the Pervade project to have identified maybe some sort of archetypal responses? And if you could say a little bit about that, please.
So one thing we've been doing is we're calling it the roadshow. This was so instead of having a convening like a Belmont where we invite all the ethics experts and hash it out and make some rules, we're instead taking this tool to data science conferences. And we get a booth in the expo hall. And of course, this is just starting because they're just starting to have expo halls again at conferences. And so we've taken it to a few places that we knew were sort of close to us, and we knew would be good pilots, like AIR, which is the Association of Internet Researchers, which has its own very contextual, lovely sort of code of ethics for researchers that they recommend. And so, we got feedback there. That was very friendly feedback. And then we started taking it to data mining conferences and places where, we don't know that world as well, except for that we've been studying it, right? And I've been trying to get feedback. And so far, people have been pretty receptive. Students particularly, well, the first question we get is, are you hiring? Because we're in the expo hall, and then we're always like, no, sorry, this is not what this is. I apologize, we don't have any jobs. So, but once we get past that, we talk about with this tool and would this be helpful to you? Folks in academia, which is who the tool is initially designed for, do seem really surprisingly and happily receptive. I think lots of, especially students who are sort of coming in now and who have lived through the techlash and the data associations with that are already coming in and saying, okay, I don't want to just use data wholesale, right? I want to be careful about it. And so they're happy to have, but they don't have the training, they don't have the background, they haven't encountered research ethics, from AIR or whatever yet in their journey. And so this is a helpful link for them. So we've gotten really positive feedback from them. We have gotten a lot this question of what about outside of academia, right? Norms for industrial research, because of course, industrial researchers are also interested in these questions and come from academic backgrounds largely. And but our tool is not it is both is and isn't. It wasn't necessarily, it's made for the context of where you can assume this is not about profits, this is about new knowledge creation, right? And that's sort of the assumption behind the tool. That said, we are interested in whether a tool like this would be helpful for folks who are working in industry and want to push back against some of the pressures that they get from, to just use all the data and to just find out the next. And so, that's a more delicate conversation. It's not totally clear that this, that the tool is the right fit for that, but that's sort of the next project, I think, for a lot of us on Pervade. Is we're really interested in industry uses of data. We would like to be helpful to people who want to be thoughtful about how industries use data. But it's a more complicated, academia is the easier case, right? It's where we started because you can at least, we all have a sort of social mission at the end of the day.
Yeah, I mean, that's great. Not that everyone in academia would be receptive. I mean, there are loud voices that maybe aren't, but I think as is so often the case, they attract attention in a way that overshadows the majority that seem to be very receptive, particularly in the sort of upcoming generation. And I guess just from experience in building research ethics review processes in health contexts for projects involving the secondary use of big data sources, machine learning, and so on, dialogue with researchers is often that that they just want to know what they can and can't do. But this approach is a bit different from that. It's right. It's encouraging. It's like, well, that's actually not the right conversation to have. There's a different one to have. And so, I mean, that seems like a really constructive shift, which is a big part of kind of my enthusiasm for this work and for your presentation. So, shifting into ethics education and encouraging critical reflexivity seems to be a really sort of promising move. So that's great.
Hope so. That's the hope. Yeah,
Yeah.
It really just, it very much comes out of exactly the same experience as you of sort of having people say, so what should I tell this person? And I'm like, well, here are the 8 questions I would like to ask next, right? And like, have they this, have they this, and this in their field, do they do this, right? You know, like, and wanting to recreate that experience on a sort of a more, scalable way.
Okay, I will continue to take prerogative and just ask one more question. We're at, we aim to close the conversation down at 10 to 5 p.m. Eastern time. So we just have about 5 minutes. So that's just kind of a heads up to the participants. If you'd like to ask another question, we're sort of at your last chance.
Oh, can I ask a question of the crowd before we do this last?
Certainly, yeah.
People
Katie,
could put in the chat, which is one place we have not tested the tool is in sort of pervasive health data spaces. And so if folks know of conferences that are, in the space of like asking questions about or using, lots of like digital mental health or digital health in various ways that we should come to, I would love to just see suggestions in the chat because I will note all of those down and because we would love to just like intersect with this world more. Sorry,
sure.
Go ahead, Jay.
And we may get responses to that offline as well, and I'll be happy to forward those on to you, Katie. So
awesome.
So my final question for you then, Katie, is around just a comment you made during your presentation that on the assumptions around vulnerable groups, what constitute a vulnerable group, and in the sort of old paradigm of research ethics, that's very clearly defined, homogeneous, sort of well-bounded group entities. And now there's something a bit different. Could you say a little bit about like, what does big data, pervasive data do to those categories? Can you just say a little bit more about that?
So big data really illustrates intersectionality, right? Like, because people are vulnerable in one single individual is vulnerable in several different ways, potentially, to companies, to researchers, to employers, and data could be passed between all of those entities, right? So in a traditional health research model, you might be studying people with who have been given diagnosis, which is traditionally stigmatized, right? And so it might, at least in my IRB experience, that wouldn't necessarily be defined as a vulnerable population, but that population could be vulnerable to employers, for instance, or to insurance companies in the US. I know this is less of an issue in Canada, but in the US, this is a big issue, right? And so there's an issue where if you are able to, for instance, identify so an example that gets used a lot, but I think it's a fairly good one, is that a US-based researcher found ways to identify postpartum depression through tweets, right? Was able to use tweets to sort of indicate like the changes in tweeting patterns over time became an indicator of postpartum depression. And so that is a potentially stigmatized diagnosis that you could then go out and make on a bunch of other people, right? Because you have this pattern. It's the pattern matching piece of it, that risk. And, some of those people may also not identify as women, right? Or they may, be part of another, they might not be documented. And those are also things that could be found through their data trails, right? And so this like idea of vulnerability, I mean, it's really one of intersectionality. And so that has to be like, it's just a much more complicated set of concepts to consider for a researcher, right? It's not like, don't do research with kids without their adults involved, right? Which is, again, a sort of bright line that you could do. And instead, okay, what if I start to identify risks? How risky is this? How do I prevent employers or health insurers or others who might use that for harm from seeing this pattern that I'm seeing? Or can I give some power back to the people who I am identifying so that they can then negotiate this new identity I may be giving them, right? Like I may be putting an identity on them that they didn't necessarily know they had. So all of those questions are just way more entangled, and data tracks that entanglement.
Yeah, great, brilliant, thank you. Okay, so we'll close off our question period, and I just have a couple of announcements to make about the upcoming weekly seminars in the SRI and the JCB's seminar series before formally thanking Katie, our speaker. So at the Schwartz-Riesman Institute, Jonathan Penny will be giving the seminar next week with a seminar titled Chilling Effects and the Future of Automated Legal Enforcement. That seminar series will be next Wednesday at 3:00 p.m. Eastern. And at the Joint Center for Bioethics, Sydney Campbell will be presenting on Death and Dying in Childhood, a Silenced Phenomenon. The JCB seminar takes place next Wednesday at 4:00 p.m. Eastern. So if you'd like to receive updates on the JCB's and SRI's weekly seminars, email addresses will, I believe, be posted in the chat for you to get in touch. So Katie, thank you so much for this fantastic presentation. As I remarked, a true accomplishment of interdisciplinary work in this space. Appreciate your patience in bringing this event together and in you taking the time to speak with us. Mina and David, thank you for your remarks and questions, which I think really kind of kicked off our conversation in a very positive way. Thank you for lending your expertise and your curiosity. On behalf of the Joint Center for Bioethics team, I'd like to extend our sincere thanks to the Schwartz-Riesman Institute for partnership in today's special joint seminar. And special thanks to AMS Healthcare for continuing your support of the JCB annual lecture on ethics and governance of AI for health. And just lastly, thank you to the audience for your comments, questions, your participation in today's special joint seminar. So thank you, everyone.
Thank you, Jay.
Thank you,
this was
Katie.
a complete pleasure. Thank you.